there is a real role for transition clinics. So at my institution, we've recently established one. So we have providers both on the pediatric and adult side who are part of this transition clinic process. And on the pediatric side, the patients go see this physician who is running the transition clinic, and she kind of does a full review of all of the medications they've on, the testing that they've had done, and sort of packages this all up in a note that sort of summarizes that. If she notes any gaps or, gosh, they haven't had an EEG in, 10 years, maybe we should get one, or, oh, look, they haven't had their vitamin D checked, let's go ahead and send that. And then she'll do those things. And then at that same visit, they'll actually meet with the adult epilepsy nurse who will, sort of let them know what to expect on the adult side. The other aspect is that a lot of my pediatric neurology colleagues manage more than just the epilepsy. So a patient may have ADHD or depression, anxiety, or sleep disorders, and they may be managing all of those things. Whereas on the adult side, we typically only manage the epilepsy piece. And so a lot of times, pediatric patients have to go see more than one adult provider to get the same sort of services that they were getting when they were on the pediatric side. And so it's helpful if the family and patient are aware of that when they're still on the pediatric side, so that could be set up so that it's not a big surprise when they come to see the adult neurologist and we say, oh, typically we don't manage those things. And so I think the transition clinic can be very helpful for that. So I'm speaking kind of in general about transition, but certainly for the ketogenic diet, that would be very helpful as well, sort of knowing where they are with the diet, what the sort of anticipated duration. Is this going to be indefinitely? Are they going to try coming off before going to college? Kind of what's the plan for that? And then what the realistic trajectory is in terms of the patient being able to continue it. So if they're a patient who requires full care, then likely their parents or caregivers will be doing that. But if it's a patient that may be going to college or living on their own, we have to figure out what's their ability going to be to do that. And so some of those conversations hopefully would have been set up on the pediatric side, and then we can sort of help facilitate that on the adult side.